I'm Dr. Eileen Moore, and I'm one of the pediatricians and also the medical director of pediatrics here at Minnesota Community Care. What I want our moms to understand is that I and all of the other pediatric providers here really believe that picking the person who's going to help you care for and raise your child is maybe one of the most important decisions that a parent can make, and we take that so seriously. It's really sacred to us. So what are we here for? We're here to make sure that you and your baby are bonding, because we know that bonding is the most important thing in terms of helping your baby develop resiliency and be able to handle everything that the world throws at them. We're also here to help make sure that your baby is growing, okay? We're here to make sure that your baby's thriving and that any questions you have are answered. No question is a silly question. I myself have twins that are now 7, and when they were born, every question that you have, I had too, in stereo. So feel free to ask us anything. We are here for you. We will see your baby every day while you're in the hospital. And there are a few checks that need to happen before your baby's discharged so that we can make sure that everything is going right on track. We check their heart, which is a screen where we check some oxygen level on their finger and on their toe. And if those are the same or close, then everything looks great. We also do a newborn hearing screen because we know that while most babies have perfectly fine hearing, if there is a problem with your baby's hearing, we want to catch it as early as possible, because earlier help means that they will have normal speech development and we can take care of any problems before they get to be too big. We also do a newborn screen. The state of Minnesota is amazing in that over 100 metabolic and genetic diseases we know how to screen for, in the state of Minnesota at no cost to you does every one of them we can to, again, make sure your baby is as healthy as possible. And then the last screening is we check their bilirubin level on their skin. Bilirubin is a pigment that can build up. You see it more in the skin, where the skin turns a little yellow, but sometimes if it builds up too much, it can actually build up in the brain, and we certainly don't want that. So we start out by checking the level of that bilirubin in their skin. As with all our efforts to keep your baby as healthy as possible, we are recommending that babies receive their first hepatitis B vaccine while they're in the hospital. It's one of those vaccines that we know that can be transmitted at birth, so we just always want to take every effort to keep your babies healthy. When you come to the clinic for your first couple of visits, there aren't any vaccines then, but we'll start the series of vaccines when they're 2 months old. The perfect age, so they've grown a little bit, they can handle the vaccine, and any questions you have about that, feel free to bring up with your provider. There are 2 other options that you have that the nurse will talk to you about when you go into the hospital. One that we recommend is to put some erythromycin, it's an antibiotic ointment, in the eyes. We recommend that to all babies at birth because there are some uncommon but possible infections that babies can have, and that could affect their eyesight. So by putting the erythromycin in at birth, we get any treatment that's needed in as fast as possible. One other treatment that we recommend for all babies is a vitamin K injection at birth. So what is vitamin K? Vitamin K is one of the factors that your body needs to be able to clot effectively, for blood to clot when you're bleeding. So babies can't make those factors when they're first born. So by giving them a dose of vitamin K, if there is any bleeding, it helps them be able to clot.